Hi, I'm Louise Frampton, the editor of Clinical Services Journal. Welcome to our webinar on the use of examination gloves and sustainability, sponsored by Arca Medical. Now, we know that gloves play a crucial role in safeguarding both healthcare professionals and patients, and proper usage according to established guidelines, along with the quality of the gloves themselves, is absolutely essential in achieving effective protection. This topic will be of great interest in the UK and across many countries and healthcare systems, where mitigating cross-contamination risks, reducing waste, promoting responsible sourcing and enhancing sustainability are all really high on the agenda. Different countries and authorities have implemented various initiatives to address these concerns, and today we'll hear the Portuguese approach, where healthcare associations have published a consensus on glove usage and quality standards across different procedures and risk levels. The publication aims to provide healthcare professionals with clear guidance on best practice. Within the NHS, in Portugal and across other geographies, we share a common objective in prioritising health and safety. And we hope this session will offer valuable insights into how our colleagues in Portugal are raising awareness on enhancing the safety of both healthcare professionals and patients through informed glove use and quality considerations. We're joined today by Dr. Paulo Alves, a researcher at the Catholic University of Portugal, who specialises in wound care and patient safety. He has a special focus on the use of advanced wound dressings, exudation control and infection prevention. We're also joined by Dr. David Perez, a certified infection preventionist and president of the Portuguese National Infection Control Association. Over to you, Paulo.
So we're going to start again about talking about the best practices in healthcare and the use of examination gloves and sustainability. We're going to do an approach, me and Dr. David Perez, to explain how we decided to do a consensus document, but we need to focus why we needed to do it, why we need guidance, and why this problem that probably is a global problem, how we see specifically with our approach. And when we talk about guidelines and guidance, of course, we need evidence and we need also experience, but let's focus on the gloves. And when we talk about gloves, as I said previously, we are talking about gloves that we use just a common piece of cloth, but when we're doing certain works like the butcher, like in a laundry, wherever, we use gloves to protect ourselves. And when we talk specifically about healthcare professionals, it becomes like a piece of our work. That's why we need to understand that when we focus specifically in the work of each one, like the man who repairs the tires, like the vet, wherever, we use the gloves not only to protect ourselves, but also the equipment that we're using, but we also use gloves in different contexts. For example, since we are near Christmas, you see here a Christmas tree with gloves, and we see, for example, a lot of different gloves with different colors for the kids to play. But when we go to specifically to clinical situations, like trauma situations, like even in uncontrolled environments, gloves play a huge role. Of course, in each context, we have gloves in different situations. For example, if you are giving a vaccine, we don't need to use gloves. But if you are talking with a pre-hospitalar or pre-emergency unit, we need to use gloves to protect ourselves and also to protect the patient. But sometimes where the gloves are in some specific containers or even in a bag, in different situations, that can be complicated to be or to use in a correct way. Other things that we need to say about gloves is we are talking about the use of gloves during the cycle of life. As you can see here on the left, you see a birth, so we use gloves in these specific situations, even if it's in the street that we had that kind of situation, or in situations of death or even forensics. So the use of gloves, it's common, and we need to understand that they are so important, but only if they are used on the correct way. Of course, we also play with them, as you can see here, doing like a balloon to a children, or even during COVID that we'll talk later, we use the gloves with water to to simulate some hand, or even when you collect some effluents, sometimes they use gloves that's not correct. So we need to understand that we use this in a traditional way, but we need to understand what should you do and use it properly. And the thing is, we need to combine evidence and experience. And why do I say this, and why we thought that we need some guidance and have a consensus document? If we look only to evidence, and since I'm working a lot with wound care, we know that, for example, 5,000 years ago, there were no internet, there were no Wi-Fi, there were no indexed magazines. We knew, or the men at the time knew, that if they approach the edges of the wound, it would heal faster rather than in second intention. So what they decided to use, they decided to use the claws of the giant hunt soldier that you see here on the screen. They approach the edges of the wound, then the giant hunt would bite the wound, approach the edges, and then they remove the body and leave there the head. So probably this is the first technique of suture. So we need to realize, when we talk about evidence, we always need to look to the past and learn with our ancestors what they've done, how they thought, how they changed the way they see things. That's why evidence, it's always connected with experience. And what I try to bring here is, when we talk about gloves, and of course there are some standards that you need to follow, it was not always easy to use gloves. And if you look to the past, and we're talking about the 19th century, you see here 1890s, we see that we started to speak about the use of surgical gloves. I'm using the experience of surgical gloves because when we talk about examine gloves, it's different than surgical gloves. But the principle of the use of gloves at that time was not accepted for everyone. So you can see that that was a controversy about the use or not of surgical gloves. And especially the surgeons felt that if they are not able to use or to do the surgery without using gloves, they will lose sensibility. They would lose the track of the instruments. They would lose a lot of characteristics that the skin gives them that would increase the risks of a bad surgery. But what we know with the past, we know that the gloves, the antiseptic of the hands, made huge revolutions on the incidence of the infection. So what we bring here today to speak with you is some interesting things that we need to talk. First, if you look, there's two very interesting papers talking about orthopedic surgery, part 1 and part 2. They are really interesting, from Philippe Emigot, that you can see here. And it was particularly interesting. Why? Because you can see here on these images, this drawing or painting or even photograph. And we are talking about 1875. We are talking about 1912, 1902. If you look particularly, for example, this image, picture number 2 from Beringer, there's a design that tried to explain the fragments that you see in this surgery. You can see quite well that you see the fingers and the nails. So the doctors at that time, they will not use gloves during the surgery. You see in this painting from 1875 showing surgeons during the surgery, and you can see that they are not using gloves. So we're talking about 150 years before we are now. We can see that in these pictures, in these images, or even in the picture that you see from Dr. Doing separating the twins that you can see here, they are doing the surgery without masks, of course, also, but without gloves. And you can see here on picture 3, explaining the evacuation of an extradural hematoma that you can see also here from the book of Beringer and Ferrot. You can see that they are not using any kind of gloves or any kind of protection, because at that time, what was the problem? They were thinking that during surgery, they would limitate their sensibility. And the last image, the figure number 11 that you can see here from France, during tendectomy of the adductors from 1921, you see that neither the staff or the surgeon is using gloves. So this is particularly important. Why? Because there was a revolution by that time showing that if they use some protection, they would reduce the incidence of infection. But that time they were not thinking about the patient. They were trying to reduce the impact on the skin or whatever. But during the evolution, materials that they use in gloves, they also changed. And you can see here that there's a cotton glove from 1916 that you can see here on the middle that was designed by for the end of the surgeon, or in specific situations where we didn't have any kind of glove we could use. As you can see here on the left side of picture 16, you can see the technique of protect fingers to reduce the contact and infection. This is really interesting how the evolution, the awareness that was created and increased year by year. And you can see by the 18th century, you can see here a silk ribbon. There was the first design probably of a condom, that you'll see that there was a connection between the use of latex, the use of rubber on the same situation. Then you see that the growth is simultaneously. And when you go to the past, even to the past, we see that probably the first population, it was the Aztecs that started to use rubber to do the balls, rubber balls, and also shoes, and also the gloves. And it was important to understand that by that time, they saw the importance of the use this material that is really resistant. Of course, it creates a huge impact on the population, but what really changed the evolution of the gloves, and allow me to do this, it was love. And of course, we are talking about a surgeon that was working with a nurse, the Caroline Hampton, that you see here. They were working on the surgery. They liked a lot of the work of Caroline, how they organized everything. And she said it would keep, she said that he wanted to leave the team because all the technique that was using by that time about the antiseptic techniques of Lister and also Pasteur, it was destroying her hands. And she said she wanted to leave the team. And that surgeon that later on, he married her, he asked for a company to design gloves for Caroline to allow her to stay in the OR. And of course, the rest of the staff decided that they also wanted to have that protection. And by the time you see one thing increased the other, and suddenly we had all staff and then other hospitals trying to increase the use of latex. By that time, the company that you know today by Goodyear, and apologies for the marketing, but of course there was a large experience with using the latex. That's why there are two important things at that time, and this is important to reference. Gloves were introduced initially just to protect the theater staff and the surgeon hands from infection, not to protect the patient. And by that time, there's only the protection of the hands of the staff, and as I said here, and we changed materials from caicum of the sheep, cotton, silk, leather, and of course things changed, and of course the introduction of latex by Goodyear that I've already said. So that's why it's important then to see that the staff and the hospital started to use the rubber gloves, and of course they increased to be how can I say, they were started to be interested in more and more quality of the material. And you can see here this document from 1927 from notes of books that you can see here. There was a surgeon who wrote about the importance of the rubber surgical gloves and tried to say that they found that there's a company who vulcanized in a different way that allowed to use, and it was interesting that says, I used the same gloves twice in the patient, and it was really satisfactory. Today, we don't see this in a good way, but by that time, it was easy to clean, and again, to a process of cleaning would allow us to reutilize the gloves. And the other thing they started to be worried is about the quality of the rubber, the quality of the material that were used. And there's a description from 1961 that you can see another surgeon saying that there's a risk of perforation of the gloves, and he was able to see that holes would make the contamination of their hands and also to the patient. So that's when things started to change. And of course, since 1910, as I said, they changed the materials. They tried to find better materials to benefit both the gloves and also the condoms. So that's why the combination of its subtle and reliability that that they wanted to ensure the maximum sensitivity to the condom and also to the gloves. And that's why we have an evolution together. When we had COVID, and this is important to transfer, why we need guidance to say, in the beginning, as you remember, it was difficult to understand what PPEs we should use. And especially the gloves we saw in some countries, and also here in Portugal with our experience in ICU, for example, the use of one glove just changed the second glove. There was no guidance specifically what to do. It was a new thing. And particularly one thing, it's difficult to assess the patient to do differential diagnosis. We know that PPE limitates our sense, vision, other sensibility. So even the vision it's different. And particularly when I say my experience in wound care, for example, I was not able to feel the temperature of the skin. It was more difficult to feel if I felt the pulse or not of the patient, even to see the wounds, blurry vision. It's complicated. And when I used gloves, we need to have sensitivity to approach. But there's one risk that I want to catch our attention is when we use gloves, sometimes there's a feeling that we are protected, and sometimes we don't use correctly the gloves. For example, we touch the patient and then we touch all the different equipments, and then we take out the gloves, we don't wash hands. Those things we need to create awareness. We need to be strict on the use of gloves and also our hand hygiene that we're going to speak. Why? Because when we have a patient, of course, we need to focus on infection and cross-infection. But when you have a patient, you have a lot of different variables, a lot of different equipments. And of course, it's difficult to control. And specifically, when we talk, for example, of skin assessment, the use of gloves is important to protect, it's important to touch, but still, there are some situations that we don't need to use gloves. So we need to understand when it's really needed. And one thing is, even the gloves and the use of antiseptics, we are talking a lot about microbiome. We know much more now about microbiome. And it's important to understand that the skin microbiome is changing our knowledge. And we need to understand that sometimes the use of the inadequate use of gloves and also biocides and also antiseptics can destroy our microbiome. So we need to understand what is the equilibrium or the balance. So that's why we need guidance. So particularly when we talk about, for example, in wound care, when should you use an exam glove? When should you use a surgical glove? In what circumstances we need? So we need to have the standard of care. For example, I use here the standard of care for pressure ulcer management, but we need to have a standard of care, because if we don't use quality and safety, we'll pay much more money. And the lack of quality is a risk factor for health institutions, and they will pay much more if they don't have quality. So that's why today we need to understand that the use of gloves will help us to protect, of course, ourselves as a barrier, but of course we need to understand that basic infection control practices are also needed, because we want to protect hospital-acquired infections. And of course, sometimes we are in hostile and invasive environment that's complicated to control. So that's why the increase of infection, hospital-associated infection, increases the number of days hospitalization. And of course, it has a huge impact on the costs, not also for the governments, also for the patients, and also for the carriers. So that's why some studies in Europe, they show quite well that we spend a lot of money in this infection-associated and hospital-associated infections that we need to control. That's why WHO and Dr. David Perez will speak later on this. They show that when and how we should use the gloves, what health workers should do. And this is important. Why? We need to have guidance, because if we don't use correctly, we'll have like this bag. It's like the continuance of infection. We don't have a separate moment. So that's why when we talk about, do the gloves protect ourselves, we need to think, maybe if you don't use it correctly, This cross-contamination, gloves can be a reservoir for nosocomial infections. At that time, it was written like this. So it's important to understand that we need to use quite well the gloves because they may harbor microorganisms. Of course, we can say that materials are not a good how can I say, environment. Latex is not a good environment. Rubber is not a good environment for microbial microorganisms to grow, but still there's a risk that we need to control. And also, of course, use all the other techniques of infection control. And the other thing that is important is how can we measure this? That's why we're talking about disposable gloves. We are talking about how the healthcare professionals should be aware of non-sterile or sterile gloves, when should they use? And of course, one of the things that it's really important to understand is when to use it, and specifically try to understand, are all the gloves the same? Because look, until the moment you use your gloves, think, sometimes they are built or they are disabled in a completely different continent. They are transported by sea, so several months in a part of, for example, paper. That's why the disposable, how the gloves reach to you, how you can use the gloves, it's really important. Then the time they spend in customs, then the time they spent in distributor or warehouse, how are they controlled, and then how they stay at the warehouse at the hospital for a long time. Can we answer? Can we consider that these exam gloves are clean? There's a lot of questions that sometimes we don't know the answer. And the last thing is, gloves, it's one of the PPEs that we most use all over the world. An important thing is we are talking about sustainability. We are talking about latex, we are talking about rubber. So we are talking about materials that they have a huge impact on the environment. So thinking today, we don't have different materials that are more or less sustainable. We need to continue to use this protection. But what we need to change is, first, try to understand, that's why Dr. David Paris will speak later, is when should we use? So there's a campaign that in the UK and several countries, they struggle when to use gloves. And it's really important because we need to ask, to glove or not to glove, when should you use it? But more than this is, sometimes we use gloves that they don't have quality. And the thing in the end of the day is, yes, we use that glove that doesn't have quality, it's destroyed, it lost completely the barrier that you need to protect ourselves. And of course, sometimes even to take out from the box, you take one, gets 1, 2, or 3 or more than that, so you spend much more gloves than you decide. So that's why it's important to see that these exam gloves that remain intact through the procedure are much more effective because they maintain the barrier and there's a less waste on the use. So this is really, really relevant. So where do we want to go? Where are we? And we need to reflect. First, we've seen that there's a huge evolution on the medical gloves and shaped completely the infection control. Today, we have the challenge to ensure the proper use of glove. And this is really important. And the last thing we need, and apologies about the mistake of writing, health policies and guidance to define what are the best practices for safer and more sustainable healthcare. That's why we change now to Dr. David Paris to say that document that we designed to understand what are the best practices in the selection and use of examination gloves. Dr. Paris?
Hello, thank you, Dr. Paulo. So after this interesting historical introduction, I'm going to talk about the document of this best practice consensus paper. Next, please. So in the structure of the so this paper was done under the coordination of the Portuguese Oncology Nursing Association and with the collaboration of other healthcare associations, namely Portuguese Oncology Nursing Association, the Society of Nursing in Critical Ill Patients, Association of Portuguese Operating Room Nurses, Portuguese Association of Wound Care, and National Association for Infection Control. Next, please. So, and the document has this structure. It does an introduction, a framing, and then talks about the regulation, and then lists the standards and the recommendations for the use of examination gloves. But why this consensus paper? Well, we know that the safe use of gloves contributes for the prevention of healthcare-associated infection, and we do know that healthcare-associated infections and antimicrobial resistance is a public health problem associated with increased morbidity and mortality. Next, please. And so, in this review from Lancet from 2022, they conclude that, in fact, antimicrobial resistance is a global problem, and that 1.27 million deaths are related to this antimicrobial resistance. Next, please. And of course, this is you should know this report. It's very famous. That was chaired by Jim O'Neill, and where this mortality estimates in 2050 were very, very scary, you know, and that the estimate would be around 10 million people could die in the world with lack of therapeutic options to treat infections. 10 million people, that is the population of Portugal. Next. And so we do know that there are several causes for antimicrobial resistance, and one of them is, in fact, poor infection control in hospitals and in clinics, and that's why it's important to have good practice in these scenarios. Next, please. And Dr. Paulo already told us about the sustainability, and this has a lot to do with the One Health concept, that we're human beings, we're not alone in the world, and of course we have to have an equilibrium between human health, animal health, and environment, and this is important in every area of our lives and in healthcare too. Next. And we do know that multi-resistance can be spread not only in hospitals, but too in farming, in the community, and throughout travel. And when I talk about travel, next please, I'm talking about globalization. And in this study, Holmes, what it does, it compares the airplane trips with some multi-resistant microorganisms, and he does like a parallel between the phenomenon of globalization and the spread of multi-resistance around the world. Next, please. So, but again, why this consensus paper? We do know that PPE is very important to contain and minimize healthcare-associated infections and cross-transmission, and this type of PPE has to obey certain behaviors and practices, and we do know that proper use of PPE is part of the infection control standard precautions. Next, please. And when we talk about good practice, we do know that World Health Organization has this very important document where it talks about the infection prevention and control programs with design in that has several areas, namely guidelines, education, surveillance, monitoring, audit, and feedback, and wrapping all of these multimodal strategies. And we do know, next please, that the standard precautions are an example of multimodal strategies in infection control. And it's part of the standard precautions that we use personal protective equipment in order to have good practices in healthcare. Next, please. And what do standard precautions say about gloves? Well, we should wear this type of PPE when we have the risk to having contact with blood or other body fluids, and in isolation precautions, of course, we always have to wear them. We should remove gloves after taking care of that patient or doing that specific procedure that we plan to do. This is very important to avoid that the contaminated gloves start, touching the areas that we don't want and contaminate the environment or even other patients. It says too that the use of gloves does not substitute the hand hygiene, and this is very, very important. And I think it's one of the mistakes that we see in the daily life. Is professionals using the gloves, taking off the gloves, and forgetting about hand hygiene. And this is really very important. It does not substitute; it complements. And of course, it says that we shouldn't reuse. These are single use, so one pair of gloves, one procedure, and out and change the gloves. Next, please. So, and as already Dr. Paulo Alves said, it's the type of PPE that is most used, and the really main use is protective barrier to patients and healthcare professionals. And in reality, all of these reasons, it is important to have this information concentrated in one document in order to be more accessible to health professionals and other interested parts. Next, please. Speaking about regulation, the gloves are a kind of personal protective equipment, as I already referred in, but it's a medical device too. So it has these two types of components, which is important to know. Next, please. And the European norm is 455, the European standard that evaluates the quality and the strength of gloves. And in this regulation, it refers the kinds of gloves that we can have. Single-use glove, of course, it can be surgical glove or examination procedure gloves, and these later ones can be sterile or non-sterile. Next, please. And in this regulation, it is divided in 4 parts, and part 1 is testing the gloves for the presence of holes, and they do this leak test where they fill the glove with 1 liter of water and check if there is holes. And the indicator that is used is acceptable quality limit value. And when we consider healthcare, we have the upper limit of 1.5. This means that when it's closer to 1.5 or more than 1.5, the quality is worse. Okay, so for instance, let me show an example at your right. In a lot of gloves, 4 million gloves, they take a sample of this lot, 500 gloves, and to have a 1.5 acceptable quality limit, this means that only 14 of these 500 gloves can have holes. And this is how it is calculated, the acceptable quality limit. Next, please. Then part 2 has to do with physical property testing. And so this test is carried out to evaluate the force that is required to break the glove. And you see that depends of the type of the glove, the force needed to break, the maximum force needed to break is different. Surgical gloves is 9 newtons rubber gloves like made of nitrile and latex is 6 Newton, and thermoplastic gloves as vinyl, for instance, is 3.6 Newtons. And so this is very, very specified too in this European norm. Next, please. Part 3 and part 4. Part 3 is to test for biological evaluation, and they assess the amount of chemical residues present. And part 4, the determination of shelf life. Okay, and this is to guarantee that they don't degrade during transport, storage, and usually the maximum period of validity allowed is 5 years. Next, please. So this is in the document. There is this table where it talks about the 4 parts of this norm that I won't say it again, but it's more objective to see this in the table. Next, please. And so I'm going a little bit going through the document, and now we're going to talk about the standards and recommendations for the use of examination gloves. Next, please. And so in this document of WHO, it's a technical aid to about gloves, and the general ideas is that the objective of the gloves is to reduce the risk of contamination of the hands, and this has to do not only to protect the health professionals, but to protect the environment and the patients, which is quite important too. As Dr. Paulo said before, first, the gloves were used only to protect the health professionals, but if we use well the gloves, we can protect all of these dimensions: the health professionals, the environment, but the patients too. They're single use too, and the document refers again the importance of being single use. Okay, and it says that the gloves can have defects, so it is important that health professionals know this, and for this it's important to know that always hand hygiene has to be accomplished before and after glove use. Next, please. And then this document talks a little bit about when it's indicated these examination gloves. And as I said before, you know, when there is the risk of having contact with body and blood or other body fluids and contact with mucous membranes, you should use these gloves. Next, please. But when you do the glove selection, you must be aware of other things besides the color or the size of the glove. Okay, and we should know about, I already talked with you about the AKL, that must be maximum 1.5. I told you about the tensile strength, about the newtons in the unit newtons, but we should know that, and I'm sure that this happened with you already. You know, when you take off a glove, it comes, you know, 3, 4, or 5 at the same time. When you take off a glove and, you know, you're touching the fingers of the glove or other parts of the glove, or you know, or the box of the glove is already semi-destroyed. And this is important too in the glove selection, is to have first the gloves to be orientated towards the opening, the glove cuffs, in order for you only to touch the cuff when you take off the glove. Yeah, and it is important to have boxes that are made in order to avoid contamination. And it says too, and the good practice says too, that when you take a glove, you should take only one glove, not coming out other gloves. And so when we choose what type of glove we want in our healthcare institution, we should have into account these factors too. Next, please. But other parameters are important. Dr. Paulo already told us about sustainability. And in fact, it's important to have to check out if there's the possibility of the packaging being recycled, if by the matter of of the transportation, if it's the production is nearby the place, the production and the place that is used, because as more transportation is needed, more it would be ecological footprint. And it's important too to have the packaging to guarantee that the gloves are not contaminated. It's important to guarantee that the gloves are inspected, and we already talked about the regulation. It's important that the gloves don't have they are particle free too, and that the production is controlled, is in a controlled environment to avoid the contamination of the gloves while they are being produced. Next, please. And the document too does a risk evaluation in the glove selection, and of course depends of the kind of procedure and the kind of risk that is associated to this procedure to us use a specific kind of glove. Can be sterilized, surgical gloves, can be procedure gloves, sterile or non-sterile. Next, please. And the document gives 2 examples of what following the task that you have to do, what kind of glove you should do. So this is very graphical in order to be easy for the health professional to see this. Next, please. And as I already told you, the performance of hand hygiene before and after is absolutely mandatory, and sometimes this is something that is forgotten in practice. And you know, many of the studies, and we already know this, that we know that hand hygiene is one of the most important and basic infection control measures, and is the first line of defense. And we do know that gloves are not, are not 100%. Do not offer 100% protection, because sometimes they have small holes. And so hand hygiene continues to be very, very important as a complement to glove use. Next, please. And it's important too, the technique that you use to put on the gloves and put off the gloves. Yeah? And you see, it's interesting in this image from the document of WHO, you see the package, and you see someone is taking the glove out of the package and is touching the package. Yeah, this is today there are other kinds of packages that avoid touching the package, because it is a critical moment where you can contaminate your hands after doing the hand hygiene and before putting the gloves. And it's here it's represented here the importance of just touching the glove in certain areas to avoid contaminating the glove before its use. Next, please. When you remove the gloves, is again important to just touch the way you remove the glove, avoiding to touch your skin to avoid you being contaminated. Okay, next. And this is a study and talking about contaminating hands after removing. This is a study where they did in a simulation, and they concluded that 37 of healthcare professionals using their doffing technique, contaminating their skin with the solution that they're using for this simulation. And so and they say that and this can be more problematic when you talk about high-risk exposures, such as handling contaminated body fluids, prolonged exposure, and failure to correctly use the PPE. Next, please. But it's important too to have training the health professionals about the good practice. This was a small study that I did with my medical students, colleagues, and I concluded in this small study that there were deficiencies in the curriculum and training of junior doctors, especially related to contact isolation and glove and mask use. Next, please. So I conclude my presentation and, you know, talking about this consensus paper with some take-home messages. First, safe use of gloves and their quality interferes with healthcare-associated prevention and avoids the spread of multi-resistant microorganisms and protects not only professionals, patients, and environment. And examination gloves that remain intact throughout the procedure that we want. First, they provide more barrier effect and less waste. And by last, safe use of gloves implies that the adoption of good practice recommendations, and this document has several of these recommendations that they are ready and very easy to access. Thank you very much for your attention. And back to you, Louise.
Thank you. Some really interesting insights there. We've got some time for some questions, and we've got some coming through now. Don't forget, in your right-hand corner, there's the opportunity to add some questions here, but we've got some coming through now. So if I can just ask you, we've got one here. In the UK, most gloves are placed in a Danny Centre dispenser. These dispensers are not always located at the point of care. Where are gloves located in Portugal, please?
Do you want to answer, David, or should I do it? Oh, yeah. Please go.
We can both give our. So it depends a lot of the institutions, of course, and the infection control recommendations. But usually we have the gloves are before entrance in the room, okay, and they're there in the dispensaries before entering the room, so they're outside of the unit of the patient to avoid contamination, but they are very quite near the point of care, so because they are in the entrance of the room. Dr. Paul, do you want to add something?
I think you answered this. It's the same example. It depends on the context, depends on the unit. If you're talking about ICU, and for example, Louise, allow me to do this. The question, for example, I work a lot with colleagues that work in, for example, in the emergency unit, you know, and also in the streets. And there, for example, it's really complicated. You need to have it, for example, inside of the car, you know. So it depends on the context that we are doing, but majority of the times. And you touch in a very interesting point. We need to have a space where they are located. Where I think it's fragile, it's people sometimes they try to remove from one side to the other, and that plays a complicated situation. We need to have in a specific place near the point of care, at least to reduce this impact. But of course, it's similar to the NHS or to United Kingdom or I think we have the same issues. I think different countries, same point of care, but always, again, the same issues, of course.
We've got some questions coming through thick and fast now. So the UK national guidance has changed fairly recently to mean that universal gloving is not recommended for contact precautions, only when there is a risk of body fluid exposure. What do you think of this recommendation? First of all, to David, if you can answer that, and then Paolo, please.
Well, when we talk about contact isolation, I think glove use should be universal when it depends of the procedure you're doing, of course, and it depends of the contact, the kind of contact you have with the patient or the unit of the patient, of course. But if we're talking about contact, so microorganisms transmitted through contact, it is important as to the professionals when they're touching the unit of the patient and the patient to use these gloves to avoid the contamination of the hands and to be a complement to the hand hygiene, of course. But again, it depends a lot of the kind of contact you have.
Paolo, what are your thoughts?
I think I don't like to say never and universal gloving. So I fully support, we don't need universal gloving. You know, the point is we need to change our habits. We need to have much more hand hygiene and all the other procedures. And of course we did, because I think what you need to realize is 2 points. First is the sustainability. We have said that. We don't have the same quality of gloving, the same way to remove gloves and keep the others there, no contamination. So sometimes gloves are a fake protection. That's the point. And I think that's why talking about universal gloving, I don't support that situation. You know what I mean? We don't need to use always glove, but we need to change our behavior. There's a lot of things that we need to change. As I said, and that's as David said, we need to increase the hand hygiene. And that's the point, because me, for example, as a nurse, if I don't have the contact skin to skin, I'm not talking as a doctor also, you know, as health professionals, we need to have skin to skin. And there's situations that we need to have it. Can you imagine, I need to talk to you, I need to touch your hand, wait a moment, let's put the glove, then I touch you. You say, go away, I don't need to speak with you. You know, there's situations that we don't need to have universal gloving. So I need to separate this just to finalize. One thing is sustainability, the other thing is quality of care. And universal gloving, it's not what we need. We need to, that's why we need guidance. That's why us as an association needed to perform a guidance, a consensus paper that will help us to decide when to use and when not to use. I think the most important thing, Luis, and I promise I will shut up, is when we don't need to use. That's the point.
Excellent. So I've got another question here.
Sorry,
David, did you want to jump in
add
there?
something. Yeah, just to add something that we do have to be careful about when we use additional precautions and the kind of transmission we want to avoid. Yeah, and so be careful with this. Of course, we don't want universal use, but in many situations it has to be, right? It has to be.
So I've got another question here for you. In the UK, do you feel the push towards ANTT could in fact be at odds with some of this and contribute to underuse of PPE?
Luis, can you explain us, when you say NTT, non-touch technique, is that correct?
Antiseptic, yes, that's right, yeah, indeed.
Yeah, of course, there's also, can I start, Luis? So talking about this, I think.
Yes, you go ahead.
Of course, there's a lot of controversy regarding a non-touch technique, use of other strategies, don't use PPEs, you know, as use other strategies. I think the most important thing is we have the same goal, it's reduce the cross-contamination. Independently of non-touch technique or using other PPEs, you know, you need to use it correctly. And I think that's the point. We need to have awareness. We need to have correct education and different behavior from the health professionals. And as I said, it's easy to speak like me and David here that we are seated on a chair, but when we need to act in an emergency department, when you have 2 seconds to think and to decide, sometimes things change. And that non-touch technique, it needs to be trained, you know, it needs a lot of education, and that's the point. We need to realize that it's easier to speak rather than to implement it.
What about you, David? Have you got some thoughts that you wanted to share on that?
Totally agree with Dr. Paolo. Yeah, that you know, training is really, really, really important. And I think, well, speaking about the Portuguese reality, is still an area that we have to work a lot. But of course, it depends always on the scenario you're working with. if it's a very controlled scenario and it's a very planned procedure that you're doing, or it's a procedure that it's an emergency procedure where you have to act fast. So taking into account of this, you should plan and you should try to what risks are you having, and taking this into account of should I wear the PPE or not? Will I be able to accomplish the procedure without contamination or not? Yeah.
Another question for you here. Is there any European guidelines of minimum technical requirements for gloves, like minimum AQL, minimum thickness, and minimum weight? Paolo, would you like to answer that?
Yes, I'm afraid that I will not able to say the correct numbers and the correct norms, but there are specific requisites to the development of the gloves and tests that need to be done. But let me just say something, Luisa. I will not take too much time, but it's like dressings. You know, the tests are made in a lab. They don't replicate the clinical environment. You know what I mean? But there are requirements to analyze the quality. The problem is when they go to a tender, you know, they need to accomplish all the regulations, CE mark, never all the things. What I put in my, I don't want to be seen with other eyes, but I see two gloves that they say they represent, they've done everything, all the requirements. And when I use them, I don't see that they have the same quality. So they have a level of minimum standards, but you can have better than that and rather than that. And when you compare in a tender, you need to be you need to be fair, because they accomplish the minimum requirements there are in the EUA, in the European Union requisites, but in the end of the day, they are not exactly the same.
Got another question here. Do you believe that the gloves currently used routinely in healthcare settings are of sufficient quality to adequately protect healthcare professionals, or do you see opportunities for improvement in the quality standards to enhance safety further? What's your thoughts on that, David?
So as Paulo was saying before, you know, you have the minimal standards that the gloves should obey, but when we see in reality, many of them are not sufficient, and we have many times we have complaints about health professionals about, you know, gloves that, you know, are not sufficiently don't protect sufficiently, and, you know, and rupture very easily. And so that's why it's important the work of the teams of infection control to choose the type of PPEs that are in use in healthcare institutions, in order to test in reality and in practice how these PPEs behave. Yeah, and we saw a lot of this with the COVID, where, you know, where every week we had a different kind of PPE, and many of them were terrible. And so it is important that the infection control team can be consulted about the types of PPEs that the hospital is planning to acquire, and it is important that we can have a test with the health professionals to know about, you know, their opinions, because it's not us in the infection control that are using the gloves, it's them in the practice that are using. So it's quite important to have the feedback from the healthcare professionals.
Paolo, did you want to add something to that?
Yes, just to add one thing that David said, is we are just focused on the gloves, the quality of the gloves, but we need to understand that, look to the questions people made us. There are not only the gloves there. Where are the gloves? Where do you collect the gloves? Do you take them from the wrists, or you take them from the fingers? You know what I mean? So quality is not only the product or the material that you are using on the gloves. is how you deliver them to the health professionals. Where are they placed? So there's a lot of things different than talking just the material of the glove. That's a small part, not a small, it's a big part, but a small part of all the problem. So that's why I wanted just to have this, Liz. Apologies to be so rude and the
No, not at all. That's great. I think we've got time for one last question. Is double gloving acceptable in some circumstances, such as during surgeries? Is that a good practice? What are your thoughts? Perhaps, David, if you want to go first, and Paolo, you can conclude.
So generally speaking, we should avoid double gloving. But when we talk about high risk procedures, this can be accepted as a resource and to guarantee more protection to the healthcare professional. But generally speaking, we should avoid this, of course. But if we talk about high risk procedures, very specific ones, this can be accepted, yes.
Just to add this, Liz, never or either always. And I think there's some situations that we can use it in some, as David said, but not per routine. And I think the routine things don't work well. And I think it's the key message that we can give to that answer, to that question, sorry.
Excellent. Well, that's all the time we have for today. I just want to say a big thank you to Paolo and David for their really interesting comments today, and to Arca Medical for sponsoring the session, and to all of you who joined us today. I hope you enjoyed the webinar, and go back and share this with your colleagues. Have a great day. Thank you very much indeed. Thank you. Bye.
Bye.